Welcome to the Queens of the Neurodiverse podcast. I'm Dr. Kalin Johnson. Join myself and my wife, Marnie Bothmer, as we make sense of this neurodivergent life so you can feel empowered to reign over your neuroverse. Hey everyone, welcome back to the Queens of the Neurodiverse podcast. I am Kalin.
I'm Marnie.
And we are here to kind of chat about what's been happening in our neurodiverse lives and see if there's kind of things we can pick apart to help you understand and navigate your neurodiverse life a little bit easier, or a little bit in a way that feels more fun.
Yeah.
I think
some camaraderie.
Yeah,
I feel
too,
like
right?
That's me. I don't like feeling alone and things. So
Solidarity.
relatability.
Yeah. This is
all the words.
Synonyms.
Yes.
We like synonyms.
Yes.
Well, so what's been going on this week?
Well, it's Memorial Day week.
Yeah.
Obviously, as we discussed, or maybe I don't know when this is posted, but it is. So it's May 28th right now.
Yeah, when we're recording this podcast,
Yeah.
it'll be out shortly after.
We did a lot this weekend for us,
We
personally.
did. We
I
did.
feel like,
Which is hard.
yeah, honestly, yeah. So, okay. So I think I mentioned this last time, but obviously I have ADHD, maybe not obviously, but I feel like it's kind of obvious. And I'd mentioned it also last time, but I also have MS or something MS adjacent.
MS light.
Yeah, technically my diagnosis is central nervous system demyelinating disease. But that's neither here nor there, except for that it affects my body in ways that I sometimes forget about or I don't always anticipate. So we did a lot this weekend for us. So Caitlin's parents were up in town and we went out to eat twice. It's a big undertaking for us, especially with a lot of food sensitivities, especially while breastfeeding. She's had to cut out a lot of food things. So that takes a lot of mental bandwidth. Your dad and I actually took an Orange Theory class together, which is hilarious. We went to the farmer's market. We went out to eat again. Well, I said we went out twice. We went to eat again. We went to a graduation party. Woo woo! Shout out Katie. And then I don't know what else. We did a lot of yard work. We did a lot of physical types of things. I don't know. I just feel like we did a lot of things for us again. We got pedicures. That was good. Yeah. So, but actually my body felt like trash on especially Monday. I woke up and honestly, even Sunday, I was kind of feeling a little flary, honestly, even before then, but just my fatigue was next level. My arms felt like just soup, as Kalin likes to say sometimes, just have nothing going. I have a lot of tingling in my feet and in my hands. And so honestly, I don't know, I feel like I'm still always navigating what I can and can't do. What is too much, sometimes I could do that, maybe feel fine. Does the weather play a role in it too? Does, I don't know, am I eating something that's inflammatory? I don't know. I feel like there's always all the questions of why. It doesn't matter why, maybe not, but whatever. So I don't know. That's where my life is today.
Yeah, I think coming down off of and I think it's so hard with ADHD and also when you're dealing with being in some way kind of unwell, it's kind of this super just shitty cards in that you have this brain that wants to do wants to do all the things, but then sometimes you have this body that doesn't really support you in doing it. Even though I will say that one of the reasons that sometimes the body isn't supporting us in doing it is because we ran that body into the ground for so long.
Yeah, because I'm I used to be able to do that, and sometimes I think about it, I'm when I check off the things, it doesn't feel like that many things again, especially in comparison to what I used to be able to do. And it's I'm not 85. I feel like I shouldn't have to be whoa, got a pedicure, gotta go take a nap. But I feel like that it feels like the reality right now sometimes.
Right.
So.
Well, I think that's one of the challenges. And when I was actually thinking kind of again about this week and things we were going to chat about today and kind of thinking about what was hard for me this week and what was kind of a win for me this week. The funny thing is we did all those things and my yay to myself and my neurodivergent life was I wasn't that fatigued from those things.
Yeah, you seem to actually do really well. Which no, whatever. But a couple years ago, Kalin then couldn't do anything.
No, I was
her burnout
pretty much bedridden.
Was so intense. Yeah. So
the EDS flares and whatnot. And so I did all those things and was able to I've been able to bring back some foods that my MCAS stuff was having issues with, bring those back in. My MCAS is really under control. Hell yeah. Well, and a big part of that then that I think, again, this idea of you used to be able to, and now you can't, there's so many factors into that. But one of the things I feel I see is almost this, it's almost the nervous system, ends up learning to be in this heightened state, when you're even having fun or a good time. Like I have somebody who recently I was working with, and they were talking about how they like to like wear like the aura rings and stuff, and like track their like heart rate, things like that. And they were like, mentally, I feel like I'm totally fine in like social settings, but like every time they were like, even if I am having like enjoy the person, I don't think that I'm anxious, heart rate's up.
Yeah.
Every single time.
Yeah.
Every single time. And I'm like, well, yeah, like it doesn't really matter even if your brain's comfortable. If your body is saying like, I need to be up, like you're gonna be exhausted.
I was gonna say maybe it's not anxiety, right? But maybe it's just like performance, even, or like
mask,
like, or maybe it's like rehearsed. Yeah, just exactly like, oh, when I'm in this setting, I feel like this. Right. So yeah, well, that's true. Because we talk about your dad a lot, I feel like, but again, how he is really good at keeping his nervous system just like really low, and so he can do a lot of things. But it seems like he's never, very rarely up here unless you're talking about like an exciting volleyball match. Otherwise, he's always just like here.
Yes,
and so that's probably why he can actually do all the things and not feel like he's burning out.
That's exactly why. Yeah. So my dad's name is Stuart, so we call him Stu sometimes, but like me and my sisters will be like WWSD. What would Stu do?
Seriously though, yeah.
But like actually, like that is why he can, because he can kind of be, for the most part, in this like very balanced state. So that was like when we were doing all the things this weekend, like I literally was thinking about that, just kind of like, I call it my sloth mode, where like I just kind of let everything just be like slow and like heavy and like whatnot, because like, yeah, like otherwise my nervous system, whether it's anxiety or even fun, if I'm up here doing this, like I'm going up that nervous system curve and I have to come down the other side, and then I feel terrible. And also I know when I'm up there, I lose all interoception. So I have no clue. Am I thirsty? Am I hungry? Do I need to sit down? And when you are dealing with an EDS body that's dealing with like POTS and like blood pressure symptoms and things like that, and histamine intolerance and core dysregulating factors are things like hypoglycemia, dehydration. So if you lose track of that, like, yeah, you're fucked. Yeah, exactly. You got a one-way ticket to soup arms. Yeah. So
one-way ticket to soup.
Marnie bought herself a one-way ticket to soup arms.
Yeah. Yeah. Well, I feel like, I mean, again, I don't know exactly what actually this is. I don't know. I can't tell you. I think what actually triggered it initially was I have a lot of teeth pain. And I think that's actually what triggered my initial flare. I actually have a tooth extracted, which is insane to me. But I think just like the tooth pain that I was initially having, then having that, I think just started creating, I don't know, this like flare in my body. And again, I'm always like kind of riding up here because that's just, I think, how my nervous system is. But I think like that just like sent me off into soup arm city.
Yeah. Well, I always think of it like a slinky. Like when you're talking about like chronic issues and like this kind of unexplainable unwell or this dysautonomia, dysregulation of the autonomic nervous system, which is, again, is what controls everything in our body that we're not thinking about like all the time, that like it's really about like how low are you down the slinky, or like how high, like how much in the hole are you? And so when you have this flare exacerbation of like symptoms, it just works you like further down that slinky. So now if you have another dysregulating factor on there, you're just blown even further down. So like you feel it more versus like again, like I not in a flare. So like I can go out and go harder or forget to drink for a little bit. And like, I may not feel great, but like
you can
I'm
rebound
okay.
quicker.
Yeah, exactly. You rebound quicker, where like Marnie's like pain just like shoved her right down into that hole. So then like, if she forgets to drink for a little bit, then all of a sudden,
that's what, again, we talked about going to an Orange Theory class with your dad, and I mentioned that like I brought my like electrolytes with me, but then we went to the farmer's market, I left it in his car, and then we went and got our nails done, and I didn't have it, and I was just like, I think I got dehydrated on top of that, and so, you know, it's been a journey to get back out of it, but yeah, it's okay. But I feel like we did a good job. Like, you know, I think some people think this is obnoxious, but obviously, again, I'm a personal trainer. We like to work out. So Monday I was planning on working out and I chose not to. I chose to listen to my body. So, you know, the wins that we take with it. But yeah.
Yeah. Well, and listening to the body, again, is easier said than done in so many ways too. And like, what is it actually telling you?
It's hard. I'm going to say this also with probably every brain. I've never experienced a neurotypical brain, but for at least an ADHD brain, my brain thinks like I did the thing, I should feel better. You know, I feel like that's like when people make a joke, right? I ate broccoli, am I healthy yet? Kind of thing, you know? And so I think that's what's hard too, is it's like, okay, I took the day off, still feel like shit, you know? And so I think like, it's more just kind of the, like, I'm trying to not continuously run my body into the ground, but knowing that even if I do the things, it doesn't mean I'm going to feel better.
Yeah.
That's very hard.
Totally. Like coming out of that, like burnout or flare or symptom exacerbation, it's not like the presence or the absence of. It's like this slow crawl out of
that's
it.
so hard.
I always say like this work
Stupid.
out of that. It's not sexy. It's not cute. It's not fast. Like none of it is. And you have to look for the smallest. Yeah. Well, I try. Like, right? Yeah. We dress it up.
Yeah.
But like we have to look for these like really, really small symptoms, I guess, really, or examples of like we're moving in the right direction is really what that is. And then it just slowly out of it. The good thing is like when you get out of that, like probably like what a lot of my patients, that initial really bad flare, the good thing is you tend to bounce back quicker.
Yeah.
Like, yeah, that's what we're looking for. Because I'd still say for your body, like I still think you bounce back quicker than you did. I mean, you're not like having an MS like relapse.
Right. Yeah.
So,
yeah.
Like,
my limbs actually do work. Yeah.
They're just
my eyes track with each other.
Yeah.
So yeah, that's a win.
Yeah. So like, and I know that seems kind of like, well, there's a win, but
Yeah.
but also like,
right. It is.
Yeah. For sure.
Well, it's a fine balance too, right? Because it's like in theory, again, because I think a lot of times, again, people have gotten to the point where you have soup arms or you're bedridden for a year, 2 years, because you continuously not listen to your body. So it's hard too, where it's like, okay, well, I don't feel good. My, my hands and everything are tingly, but I could force myself to go do it. So I think that sometimes is what's the hard point too, is it's like most days I don't feel incredible. Right. And so kind of knowing like what that, and I feel like, I know a lot of my patients, I'm sure a lot of your clients ask that too, but like what is pushing too much? What is not pushing too much? When do we, kind of continue to push that boundary or not? I think that's hard because if I feel like in life, if you're ever waiting to feel like amazing, like you're never going to do anything, So also just kind of like, I don't know, I think that's a hard nuance.
Well, and on top of that, I know with a lot of my patients, part of the issue too is like with like, we live in a capitalist society. So sometimes you recognize
I have to work.
Right. Like I want to rest, but like I have to work. How do you marry that together? And like part of it is just validating like, yeah, you're right. Like that sucks that like you can't end up resting as much as you want, but that is that like piece. So like my approach with that with myself and like with anybody that I work with is again the same idea, kind of like my dad, that like you can show up and work in a way though that isn't going to increase your burnout.
Yeah.
So like when I first started doing my work one-on-one with patients, I was coming out of that burnout, but burnout takes like they say on average 3 to 5 years to recover from. I would say after 3 years, I was definitely noticing marked improvements. It was about 5 of where I feel like I'm not going to say like my old self because that's not really a reality anymore.
That's not the goal. We're not trying to get there.
No.
That's
like yes, but like where I feel like I'm very confident in like navigating life and feel fairly quote like normal in my life again. It was 5 years. But I was still coming out of it then, but there were days where I would have to work and see patients like lying down, fully lying down, like whatever.
Yeah, we bought like, well, you did, but like lying down, like desk, you had like all the things like, yeah,
I did. Like
that's all the things. That's one thing.
Like I did, but I had.
But you also had a chair.
I did. I had a chair. I had a zero gravity chair. I had a desk, and just really saying to myself, and then even to my patients, that like just because I need to care for my body different doesn't mean I still can't do this. Of course, I would have been better for my body. I would have recovered quicker if I would have not had to work during that time period. That wasn't the reality. And here's the deal. I would have had other stressors if I just didn't work, like homelessness and things like that. Like that would have also been stressful. And
I mean, it's like funny, but also it's true.
Yeah.
It's just like,
So I was like, okay, I'm going to do this the best way that I can. And like really, really try. Like I had sticky notes like on like my computer and things to remind me like while I was like even in session, like with a patient to yes, be present with them, but to make sure I was present with myself first.
Yeah.
Always. And that really, really, and I truly believe this, like to be present with them, I have to be present with myself first. So it is meeting those needs. Like that actually is the ability to care for others. It is the ultimate, what we really mean when we say, put your oxygen mask on first. Because you literally cannot be present with another person if your basic needs aren't cared for. Like your brain doesn't let you be. It says, forget that. Like, I'm just going to be like, I'm hungry.
I know I've had like, I know this is a really, but like, in the middle of the night, our infant's crying. And right now, how we're doing this is like, I'll take the first one. And usually the time, like, I have to pee so bad. So I always, some people like, I'll let her cry, which is fine, but like, we can have that. But I feel uncomfortable just like letting her scream. But like, mama's got to pee. So I always pee first. And I can hear her just like screaming. But I'm like, I know I'm going to be a better mom though if I can sit with you and rock you with an empty bladder than if I'm like feeling impatient because I have to pee really bad. So that's my example.
Yes. Well, and that's the idea with like, yeah, how do we, again, like work or balance, like when to push, when not to push. Part of what I think is like helpful is like finding this way of like, okay, I'm going to do the thing, but can I do it without pushing?
Yeah.
Because I think that's the hard thing that, again, like our ADHD brains get us into. It's like, well, I'm either pushing or I'm not pushing.
Right.
It's again, that kind of like black and white. And it's like, oh, wait, like I can actually do things, both fun and not so fun, without pushing. Like I can
maybe. Sorry, I was just thinking maybe we push on some things, but not everything has to be pushed. You know what I mean? Like, I think sometimes I know like so Kalin and I both obviously value like working out, so I'm pushing my body, but I know we've talked quite a few times with ourselves like when it comes to doing extra things that like what do we value? So the things that we value are maybe those things that we're gonna end up pushing on, and the other things we just don't do or we don't push on them. So it's like, I don't know, I'm not gonna push myself to clean the shower because I'm not, and I'd rather work out. So it's just like, I think sometimes like, I don't know, you read there's a lot of shoulds in the world, right? Like you should wash your sheets once a week. We don't wash our sheets once a week. We don't wash our sheets sometimes once a month. That's just the truth.
That's the one.
When I work out.
Yeah.
I feel like it's like, you just can't do all the things, you know?
Right.
It's like, there's too many fucking things.
Right.
So you have to pick.
Exactly right. People be like, well, this is going to drop. And I'm like, yeah, right. Yeah. It is going to drop. And you have to choose
phases
something
of life,
too.
maybe more things you can push on. You know what I mean? More like right now, maybe we can push on a workout, push on working, push on taking care of my infants. Maybe another season of life, I'll be able to push on something else. Right now, that's what I got. Maybe other seasons of life, I can only do one of those things. You know, it's like, I can only, whatever, just saying, like, I feel like also like the things you can push on. I hijacked your push thing, but like, you know, kind of ebb and flow.
Right. Well, no, yeah, exactly. But I think the whole piece of that is that like you have autonomy and choice there, which actually this is a thing that, you know, I hear a lot about, especially with like Gen Zers. Shout out to any Gen Zers if you listen to this, but like sometimes they're getting kind of a bad rap, like of that they want just comfort and like don't want to push or do hard things. And I sometimes wonder if people think again, like, or I get feedback sometimes on like, is that like what this work is? Is that unmasking of just like, well, I just gonna be comfortable all the time. Like, and that's not reality. So like what this work is really about, like unmasking and that nuance that like Gen Zers like or could find to be able to actually like operate in this world. It's not about not doing things that are uncomfortable. It's not about doing things that are distressing. It's that you have choice in what those things are. So like if you are having to tolerate the discomfort of like a certain color of room that stresses you out or you don't like, or sound, or whatever, or a value misaligned job that like, yeah, you're not going to have then the bandwidth left to tolerate the discomfort of being maybe like the parent you want to be, or being able to work out, or whatever it is.
Do a hard job.
Right. Exactly. So it's like, no, like we do want you to be in uncomfortable, just like those situations, but they're not going to be
human.
Right. And they're not going to be though as uncomfortable in a way that's again not like rewarding for your nervous system and your body if you get to choose and say like, I want to do this hard thing.
Well, I think we talk about this a lot with that too, but like everything's a pendulum, right? So I think like, especially pre-millennials, I feel like we're kind of on the cusp of that, but like I feel like boomers, Gen X, they went through the route of like, just always be uncomfortable. You know, I feel like that's even like the story of like med students and things like that, like doctors being like, well, we just work 72-hour shifts, so you should have to too. You shouldn't have to sleep. Or, you know, yeah, I worked all these insane jobs and got paid shit, and I lived in squalor to, you know, pull myself up from my bootstraps. You should have to do the same thing. And then all of a sudden we were like, maybe that was a little too much. So now maybe we've swung a little too far to be like, well, I don't want to do anything that's hard, and I just want to, you know, I'm not saying it's everybody. It's just like, I feel like we kind of swing. So yeah, finding again that kind of balance of like, how do we do hard things, but not push ourselves into the ground. And I don't know. Yeah, that's hard.
Yeah. Well, and I think the thing with that pendulum is when you have spent years and years and years and years just like pushing,
Right.
the reality is like pendulum swings. So it is also normal, and that's hard for people too, to say, okay, I've spent 30 years pushing myself.
So I'm going to spend some time.
It's going to spend some time
being freaking comfortable.
Right. Exactly. Like, so like, again, like even for me coming out of burnout, like it was like 2 years of like me having to choose like my comfort first every time. Like there was no like really choosing, tolerating like distressing things. Like my system could not do any of them. Now I've gotten that pendulum to kind of quiet down to where I can kind of go back into that choice again. So also know that like in that, like that's normal too. And even like Marnie with her symptom flare right now, like because she pushed and did all those things, like her pendulum now needs to swing to where she's going to probably have to choose like rest, not tolerating distressing things as much for a while as she kind of gets that pendulum to calm down.
Yeah. Lame.
I know. Right? So like that sucks.
Yeah. I don't want that to be the answer.
Right. Well, especially again, like when things like when you're like a homeowner, like that was, I know something that was like,
it's like we have to mow, or
yes,
I don't know what's going to happen, but people will be mad. I feel like if our lawn just has snakes in it and it's snakes, and you know, you like really long grass, people get snakes in their grass, you know?
Yeah. So if we have snake grass,
yeah.
Well, and that was a total neurodivergent thing. I feel like for us that like, so this is our first time having a lawn. And so we got a lawnmower.
Yeah. That was my brain. I just kind of thought we mow the lawn. I mean, I knew we had to water it, so we have that set up. And I knew I actually was like, hey, we should buy an edger because we have like some big signs in our yard that we need to edge around.
Which we bought a weed whacker.
Yeah.
Which is different than an edger, I think, right?
Or I just think you can use the weed whacker as an edger, right? Depending on how you use it. We didn't know that.
We didn't know. We didn't know anything. And then we got a like leaf blower.
That was later because we saw our neighbors doing that with like the grass. We just left the grass on the sidewalk, but apparently, you blow it in the street. I don't know if that's what people do.
Or in the grass.
You at least just blow it somewhere.
Yeah. So it's not all on the sidewalk. So anyways, that was 3 new pieces of equipment.
Too many.
That we didn't know how to work, which wholly overwhelm for ADHD. So like literally like week 1, it was like lawnmower. Yep. And so we didn't like edge anything. And we have like a ton of area like around our fence. And we've got like this big,
we have a lot,
like the neighborhood sign of like what like our neighborhood is called. It's like on our property. So we have to like edge around that and stuff too. But we were like, nope, not doing it.
One thing.
Can't. So we did that. Yeah. So then the next week we figured out the edger.
Yep.
And then my dad was here this weekend and he was out there then like showing us how to do like the leaf blower and everything. And he was like, what did he say to you? He was like, yeah, like you really should be like blowing the grass. There was a whole lot of grass there. And
I was like, yes, too. I was like, we have ADHD. I was like, we literally bought the leaf blower and that was step 1. So I'm going to need you to not tell me I need to do it. Yeah. Maybe next week we can do it.
Yeah.
But
well, and no joke, when my dad was out there like showing us how to do these different things, because again, like him taking that on was easier for our own like decision paralysis of like, Stu, just show us like, how to turn on.
Yeah, that's the thing. It's like you have to learn how to turn. I mean, I know leaf blower is not hard, but it's like I have to figure out how to turn it on and just do the things. And it's like that is too many steps right now.
I don't want to get like like I figured out how to do the like wiring for
good job
thank you which was overwhelming for the edger, the weed whacker. And it was talking about like things you could do to like do better weed whacking in there. And I said to Marnie, I was like, yeah, there's stuff in the booklet if you want to look at that. And she's like, I'm not looking at that. And I was like, all right, like, so that's it's great.
Okay, I was like, well, you can find a video. I don't know what, like, okay, actually I think for the ADHD brain, people love videos. I don't know, like, if it just gets the information out faster, I don't know. I don't want to listen to anybody. I would like to read something. I think it's 'cause I can skim it. I don't read it hardcore. So if I have a video, I feel like I have to watch 3 minutes. So I want to be like skip ahead. But that's not a reality. So I would rather just like scroll and skim through. Just a side note.
I like skimming, but I think for me to get it, I have to have the visual component. If I can't see somebody doing it, I've like auditory directions. I want to jump out a window.
I have a slight I don't know what the word I want to use is. Trigger. It's not a trigger. I really want to learn new things, really want to get good at new things.
It's a trigger.
But there's something in my brain when I learn new things that just triggers my like inferiority, my not good enough complex, I guess. And all of a sudden I'm like, I don't know how to do this. And my brain's like, but if somebody teaches me, it's better.
Yeah. Yes. again, well, again,
Well, let's say Stuart taught us.
yeah, it kind of speeds it up. Well, when he was teaching us too, what I had to laugh is some of our neighbors, I don't know if you saw them, they had like family over and they were all sitting at their table in their front window and like watching us and like kind of like laughing at us. And I know I was just saying, I was like, that's why I didn't tell her. Cause you know, if you can see if you're not watching this video, she just gave a total like, oh hell no face.
Yeah, especially I don't want the thought of like, oh, those two girls, you know. It's like, you know what?
Uh-huh.
I don't
Yeah,
know.
I don't know what they were. Maybe they were laughing at,
Or else we'll have to be like, those cute ladies, also
that
gross.
too. Whatever. Yeah. So, well, that's a thing too with neurodivergence being perceived.
Yeah, I know.
Yeah.
Let me hide.
Yeah.
Next time I go, I'm gonna have a tarp over my head while I'm doing it. Don't watch
So
me
that's where she goes. I go the opposite route when I see something like that. Yeah. Then I just like wave at them and say, hey, like, which this is okay. I can't believe I'm going to tell this story on here, but like, so anytime I hate shame so much. So if I sense shame with anything, I go towards the shame rather than away from it. So like if somebody's like, out there like laughing, then I'm just going to do it more. I'm just gonna do it bigger. And I'm just going to like look you dead in the eye and like wave at you. So when I'm in a bathroom, it's a common thing. And I don't know if this is true in like guys' bathrooms.
Not what I thought you were going to share.
Yeah, well, here I am. And you know, people have like,
it's not a thing in men's bathrooms. You
It's
said I don't know.
not?
It's not.
Okay.
I know it's not.
Okay, it's
Shout out
not.
Marty, who told me it's not.
okay, so like pee shyness or like number two shyness that like people don't like want to do it. If I'm in a bathroom and I can tell somebody's like pee shy around, like I will like pee it out so hard and fast and to be like, we're all in this together.
Right.
Same with having to, if you have to like poop or anything, or like we all know sometimes like toilet farts like happen.
Restroom team, if anybody's not a female or for some reason if you don't experience this, but this is a thing, you sit in the stall next to people and it's just dead silent, which even like we're in the bathroom because you have to do something and all of a sudden you'll just hear the person next to you like taking so much toilet paper. And sometimes I want to be like, we know you don't need that much toilet paper. It's because they don't want to poop while you're sitting there and they don't want you to hear the plop basically. And so so we all just sit there and have a poop off, I feel like, until somebody goes.
And you'll hear somebody like flush, but then you can tell that they're not standing
Nobody
up.
got up.
So they're just, this is what I hate it so much. Like, we can't even see each other and we are auditorily masking the fact that we're going to the bathroom.
Really insane.
It makes me so mad. And so that's why then I'm like, fine, I'm just going to blow it out. I'm going to just be loud. I'm just going to do it. Like, and I'm going to try to be then like, this is my life. This is what I do though. I'm like, I'm going to be the example then that like takes away all the shame. Like, fine, laugh at me. I don't care. I can handle it. Like, whatever. It's not a big deal. Just go to the bathroom.
Yeah.
Like,
and then
just go to the bathroom.
I know it's just whatever. Say again, I know it's not a thing with guys because I brought it up once because I was like, it's apparent what men are doing because you either go to a urinal or you don't. And if you don't go to the urinal, you're probably going to poop, you know? Yeah. And so I brought that up once to somebody and I was like, do you guys have poop offs? Like, oh no, we just go in there and we just all poop. So I feel like it's it's happening in the women's restroom. We got to stop it.
Yeah. So
there's that.
Be the bathroom example like you want to be. I promise it's okay. Like I promise we all know what you're doing.
That's the thing.
Yeah.
Just wash your hands afterwards.
Right.
You know?
And why does there have to be shame associated with like, well, that's the whole thing is like, there's especially shame with the body and shame with female body, especially.
Yeah.
Which again, makes sense with like why, especially neurodivergence. Also, we carry so much shame with our mind. It's like shame, shame.
Don't poop. Stop it. That's really unhelpful to even joke about that.
No.
Just saying.
No. Like, so if you want, one of the things that can be helpful, if you feel up to it, go towards the shame. I promise it is helpful, but it definitely takes.
You were going to say, this is a lot less of a like, but we were talking about, so our new neighborhood is really friendly and everybody like, just like soup, it's great. Like, honestly. And we have a lot of like the Midwest. I don't know if this happens outside the Midwest, but when people drive, like, they just like wave. And yesterday Kalin was walking and she was like, sometimes I just want to go like, again, if you're not watching, like really big exaggerated wave. She was like, why is it just always these little like casual waves? So that's not really shame, but that's where I thought you were going to go.
Well, what I noticed again with like
pooping
masking was like when people drive by, I know, like I very much understand, especially like the way my autistic brain works. It almost like there's like this little thing that goes off in my head that says like, okay, like look at them,
Yeah.
give a little smile, raise your hand, like little nod.
This is what you're
Only raise your
supposed
hand
to do.
here. Yeah,
Yeah.
exactly. This is what you're supposed to do.
Mhm.
But I almost can tell that like when I'm doing it, like I feel rigid. Like, and
It's
I
like a
feel
robot.
almost, yeah, but I also feel like my nervous system is kind of activated doing it because it's like a masking moment of just like, this is all I'm supposed to do. Like, control it, Kalin. Like,
Yeah.
don't do bigger than that. Don't do smaller than that. Like, this
Yeah.
is how you're supposed to do it. And like it really, it's not, it happens so much faster than that, but like that is happening. And I just had that moment again, though. I was like, I just want to be relaxed. And I was like, how do I want to wave? And right now I just wanted to be like both hands, like, hey guys, like, what do I want to do that?
Yeah.
And then also the impulsivity of the ADHD
Yeah.
comes in. And all of a sudden, when I feel like I can't do it, then I want to do it even
Totally.
more.
That's
and
very
I'm
real.
like, I just want to have this like impulsive wave. But then are you going to be like ostracized, and rejection sensitivity comes into that? But then also, do I care? I don't know.
Yeah.
So all of
New
a sudden,
names,
literally,
new names saying
just this little wave triggered this entire like
cascade.
Yeah, of thought. But I think what I'm going to do sometime soon is I don't know, maybe I'm going to try a different wave. Yeah, maybe not the big one, but I'm going to find something that's more relaxed.
Can we both do it? I feel like we're already like, I mean, I think people are very accepting and enjoy us here, but I feel like we already just stand out for various reasons. Also probably because we're not weed whacking, you know, things like that. So I feel like can we sometime on our walk, like both be like, yeah, like jumping jack waves, and
yeah,
maybe we start with one person and then like we'll switch it, then I will, then we do it together.
Well, I was even thinking that part of it is like, it's even just the like the controlled nod and hand up. Like I may even just like it better if I can just like wave old school, like you do it when you're a kid, where you just like flap your hand around, right?
Like a princess wave.
Yeah, no, see that feels too controlled. Like, but
Okay,
like I just
all right.
I think I just want to like just a little bigger, just like that
freedom in your wave.
Yeah, I just want to feel like I can do what I want, like, because I think a lot of times too that takes a lot of energy to do the really big ones. Most of the time I probably won't choose that one. I just don't want to always have it be this stiff, like and like that,
like you're in the small world.
You know what? I think that's part of it too, is like, so this is a big thing too with anybody who has PTSD, which I always say that I treat every neurodivergent patient like they have complex PTSD, which is like something that was that traumatic event that wasn't just one time. It was something like over a whole like rapid series of times that ends up being this PTSD. But anybody who has PTSD, one of the things that's a huge trigger for us and that can help us get out of things is knowing that we have choice. But if we feel like we don't have choice, that's a trigger for us unto itself. So I also think for me, it's one of those things that feels like I don't have an option. If I feel like this is the only way I can do it, my brain is like, oh, hell no. Like kick back, not safe. So part of it is like, I have to like help my brain know that like I can do it a different way. Now there are consequences to
we always say that. Yeah, it's always a consequence.
Yeah.
Same with like, there's a consequence to pooping really loudly.
Yes, there is.
Bad one, but somebody might think something of you.
Yeah, totally.
So
they might.
You have to
but am I okay with that?
Right.
Like I've decided that I am. It's again not fun to navigate.
Right.
Like if somebody thinks something of me. I don't know. Nobody ever has. So,
or at least said it to you.
They haven't.
They might be like,
if they do,
laughing at their story, you know, 10 years later. Like, remember that one time at the Olive Garden and that thing happened? Like that might be.
They may be talking about it 100%. But also like
you provide comments.
I was gonna say, if that's the mark I leave on this world, I'm okay with that. Like I really am. So, well, yeah, I feel like that's been what our week has been.
Yeah. It's been a lot of things though.
It really has. Yeah.
Every week of life.
Yeah.
Right?
Yeah. I know we have to go here soon, but yeah, I guess the one last little thing I'll share. One of the things that we wanted to kind of end our podcast on too is kind of like a little like relatable relationship, like row or like little kind of tiff or something, or just like neurodivergent challenge we had as like a neurodivergent couple that have that in common and yet very different neurodivergent experiences. So I know one of the things that we ended up kind of like going a little head-to-head moment about is something that we do often, which is backseat driving. Which I am the backseat driver, 1,000%.
Backseat driver.
Yep. And then Marnie has the point of like, if she even, sometimes I'm not backseat driving, but again, she hates perception so much. So as soon as she thinks somebody is watching her or there's that perception there,
I drive first also, side note.
Exactly. That's what I'm saying. That like even possible, like the need for backseat driving or like whatever, like just like pops up more, because as soon as you even know that I'm there, then all of a sudden you're like, whoa,
And that drives so much worse. It's really ridiculous. Yeah. I don't really know what that's about. So I'm like, yeah, so afraid she's gonna say something that like I don't know what it is. It's just really stupid, but I make worse choices.
Well, and then I've had to learn over time that like people don't always want your input.
Well, I realized, okay, just a side note real quick, because we are a little bit of time, but my brain, it just like doesn't record things. So like we live downtown. There's a lot of one ways downtown. We lived downtown for what, from 18 until like 35,
15 years,
a long time.
Yeah, 20.
I don't know any of the one way streets. I just navigate them every single time. I also don't know which light switches work in our house. We could live in the house forever. There's 4 of them. I just hit them every time. I don't know what, I just don't record it, but I figure it out. I always figure out how to turn the lights off. I always get to where I need to go. And so sometimes, yeah, when she's driving, she's like, you need to turn on this street. And I'm like, can you not tell me? Because I don't know, but I will figure it out in a somewhat timely fashion.
And okay, that's the part there that like, though, like even as you were saying it, like I can feel it like in my body, like the itch to be like, oh hell no. Like drives me nuts. But this was the thing that like, and I think a lot of, especially autistic people, there's this built in us like value or like intention with everything of efficiency. So it's like, why would you not go the most efficient route? Yeah. Why would you not take time to like learn the like on and off switches for the lights so you can be more efficient like with your time? Like
I think it's too much for my brain to actually like. I feel like in an ideal world, that's a problem too. Is like I actually would like to know. Like we're both wearing Disney shirts right now. We're both avid Walt Disney World fans, and for a long time too, I would just like kind of follow along Kalin to walk in the parks, and then I realized like I've been here 30 times and I actually don't know my way around Magic Kingdom. So then I would be like mad about it though. Sometimes then I go the opposite route. She's like, and I'm like, I'm gonna lead us now, but leading us the wrong way.
I was just gonna say, which not helpful. Isn't helpful then either, because then it's just like she's just doing it out of spite and not actually like wanting to.
Yeah.
But like what I had to like really learn is that like, okay, not everybody is always doing everything with like efficiency as their number one.
Yeah.
But the little kind of like squabble like piece that we had, what is so hard is again, she's like, yeah, don't tell me basically. But then she was like, but you can tell me if I'm gonna basically do it wrong. And I'm like, how am I supposed to know if you're gonna do it
wrong? We were getting
off
on an exit and I was about to miss the exit. And I actually did remember. I was like, oh shoot, I got over. And she's like, I was about to say something. And I was like, well, if I'm gonna miss the exit, you can tell me. But also I was like, but I also acknowledge like that doesn't make any sense. So maybe tell me like I don't know, 10 seconds before, but not a minute before, like, can we try to nuance it?
Right.
Some time to figure it out, but like, also I don't want to miss the exit.
Right. Which then for my brain, then that's very exact. So the hypervigilance of like, okay, should I count? Okay, is it about 10 seconds before we're ready to do the exit? Should I say it? Like, basically, again, like none of us can win. Like we're both triggered for different reasons in that situation.
It's all triggered.
And I think it's just like each time for myself, it's like, all right, I'm going to take a chance and I'm either not going to say something and I'm going to be okay if we miss it, even though internally I'm going to want to like jump out of this car because it drives me insane. And then we're going to have to like go all the way around or whatever. Or I'm going to say it and just deal with the fact she's going to be mad at me and I said it. And like either way, like something's going to feel crappy, which this is where we talk about like making like the value-based choice. So when we make a value-based choice and we don't get the outcome that we want, we feel grief. And grief doesn't feel good, but it's a learning experience. When we don't make the value-based choice and we don't get the outcome that we want, we feel resentment.
Yeah. That's worse.
Resentment is destructive.
Honestly.
So really it's like when you're faced with something like that, like how we end up navigating those is like what feels like the most value-based choice. Like what is the one that like at the end of the day, even if
do you want to lose your own brain efficiency or piss off your wife?
Right. Well, like no matter what happens, whether she's pissed at me or we miss it, whatever, what is the response that I can go to bed and say, like, I made the response that felt like the most like me.
Yeah.
Even if she's pissed at me or even if we miss it, like whatever that is, like independent of the outcome, which I think is what's really hard for neurodivergent people is we grade our choice based off of the outcome so often. And that's what ends up making our life feel shitty. Like we have to separate it from the outcome, which is foreign for us.
Yeah,
but
it's hard.
Yeah, but that's our that was our squabble, and that will continue to be one I'm sure that we will continue to navigate, but probably one that I bet a lot of you can find some relatability in.
Yeah.
So that is all for the Queens of the Neuroverse podcast this week.
Yay!
All over the place per usual, and what it will always be. But yeah, go ahead and in the comments on the podcast, let us know like what your challenges this week were, and like what you do and to navigate the overwhelm of having a house and doing all of these things. Let us know how you navigate that. Yard work, especially when it's not a special interest of yours.
Right. Yeah.
Or if you are the backseat driver, or if you're the one receiving the backseat driving, how you guys navigate that.
Yeah.
Otherwise, we will see you next time. Thanks so much. Bye. Have a great rest of your week navigating your neuroverse as the queen that you are.
Love that.
Thank you for joining us on this episode of the Queens of the Neuroverse podcast. If you enjoyed this episode, please like and subscribe to the podcast. If you're ready for individualized support, head on over to KalinJohnson.com and MarnieBothmer.com to work with us one-on-one. Reign and repeat, my queens. Reign and repeat. None of the information presented in this podcast should be used or applied personally without consulting with your doctor about your symptoms, diagnoses, treatment, and the safety of applying any information discussed. All the information discussed reflects only the experience of the host and should be used for educational purposes only. This podcast does not replace the guidance and/or prescription of a physician. By listening to this podcast, your acceptance of this medical disclaimer is implied.